I call this the ketamine continuum. You've got a range of dosages. If you didn't know this, ketamine is sometimes referred to as a dirty drug, which is kind of a misnomer. It sounds like that's a bad thing, but what it refers to is the fact that ketamine has so many applications. You can use it for pain management, some psychiatric disorders that are resistant to other treatments, sedative-assisted intubation, and then, of course, acute agitation and chemical restraint. But there's a wide range of dosages. Highest dose there in the red, dissociation, that's when you get up into the dosage range that can, by definition, be classified as general anesthesia. Surgeries can be performed after a patient's been given ketamine at these dosage levels. Where's the recommended dose when you're simply trying to control an acutely agitated patient? That seems to be the sweet spot right about there. If you give it through the IV, 1 to 2 milligrams per kilogram. If you're delivering it intramuscular, 2 to 4 milligrams per kilogram. Now, 4 milligrams per kilogram, pretty standard now and pretty well tolerated. That's your standard adult patients. If you've got a very, very small adult, or we're dealing with a pediatric patient, or an adult that is 55 years of age or older, 2 milligrams per kilogram intramuscular is probably more advisable. Certainly, giving more than 4 milligrams per kilogram intramuscular that's a lot of ketamine. And it should be a very rare instance where you need to give a patient more than that. I'm not going to claim it can't happen, but if you find yourself in that situation, use extreme caution. And I would also hope that you are prepared to manage that patient's airway. If, for example, they have a laryngospasm, I would hope that you have delayed sequence intubation using paralytics available to you so that you can take over and control the patient's airway in that worst case scenario. Definitely try to avoid going over that dosage range if you can. Where we see these ketamine-related disasters is when the dose fell up here. Now, don't get me wrong. I will confess to being somewhat of a fan of ketamine, but a tempered fan, if you will. While the adverse effect profile for ketamine is relatively small, especially when compared against these other chemical restraint agents, folks, it's still a drug. And like any drug, ketamine demands our respect and requires that we use caution when administering it. As we continue to see the number of applications for ketamine and the overall prevalence of its use continuing to grow in the EMS, the more we use it, the more likely it becomes that we're going to see some unwanted and unexpected outcomes. With every roll of the dice, there's a chance you're going to end up seeing snake eyes. That's just how it works, no matter how great the drug is. Now, I'm about to show you a couple of videos here, and I want to stress that these videos are not intended to be unduly critical, making fun of the people involved, the paramedics, the law enforcement, certainly not the patients. I'm not here to criticize what they did or did not do, but we're going to use this as a learning tool. You may have heard about these things, read them in the headlines, but I'm going to show you a couple of stories about two young men by the name of Elijah. The two Elijahs, Elijah McClain and Elijah McKnight. Take a look.
This is surveillance video of Elijah McClain's final trip to buy iced tea at a convenience store in Aurora, Colorado last August. His family says he sometimes wore a ski mask to keep warm because he was anemic.
After paying for his items, he turns around and bows to the man behind him in line. His family told NBC News this was his signature gratitude bow. At 10:30 p.m., a man calls 911.
Yeah, he's walking south on Billings Street, and he has a mask on.
The caller tells the dispatcher a man looks sketchy, but makes no mention of any crime.
Were any weapons involved or mentioned?
No.
Officers arrive at the scene.
Stop. I have a right to stop you because you're being suspicious. Well, okay. Turn around.
And within 19 seconds, an escalation.
Let go of me. No, I am an introvert. Please respect the boundaries that I am speaking.
Stop tensing up. Stop. Relax.
Stop. I'm going home.
Relax or I'm going to have to change this situation.
All three officers wrestle McClain to the ground.
Give us more. Give us some more units. We're fighting them.
At this moment, one of the officers uses a carotid control hold on McClain, a tactic that involves an officer placing his arm around a subject's neck, applying pressure, and restricting blood to the brain via the carotid arteries. Responding officers later told an Aurora police investigator that McClain briefly went unconscious, and the officers released the hold. At 10:46 p.m., just over 2 minutes after the first officer made contact with him, McClain is pinned to the ground and says this.
Fighting us on the ground. Oh, it was Elijah McClain.
We had to use carotid.
That's what I was doing. I was just going home. I'm an introvert and I'm different.
Did he come out? He's out. Was he out?
I heard some snoring.
I just
he wasn't completely. He didn't lose consciousness.
Yeah.
I'm just different.
I'm just different.
That's all. That's all I was doing.
It was actually Rosenblatt.
I'm so sorry.
You're going, dude.
I have no gun.
That's where I tried carotid.
I don't do that stuff. I don't do any fighting.
Other units that are not here.
Why
they can slow it down a little bit.
At 10:49 p.m., McClain throws up a first time.
Stop.
Oh yeah, I'm sorry. I wasn't trying to do that. I think I can't breathe correctly because.
Over the next 4 minutes, McClain gets sick a few more times. Officers are also heard multiple times asking him to stop fighting.
Rolling this way, dude?
Yeah.
Are you able to?
My legs locking up.
There you go. Just like that.
You're good.
Don't get up, dude. It's not going to be good for you. I'm telling you right now.
If you keep messing around, I'm going to bring my dog out. He's going to dog bite you. You understand me?
At 10:54 p.m., McClain is still on the ground, and an officer says this.
So when the ambulance gets here, we're going to go ahead and give him some ketamine.
Yeah, sounds good.
Perfect.
Let's give that a couple of minutes and then we'll put him on.
Whatever he's on, he has incredible strength.
Yeah, crazy strength.
10:59 p.m. A fire medic administers 500 milligrams of ketamine to McClain in an attempt to sedate him.
7 minutes later, responding officers are told he has no pulse in the back of an ambulance.
Are you serious? Yeah.
He's revived, but is brain dead and is taken off life support 3 days later.
The coroner concluded last November that a combination of physical exertion and a narrow left coronary artery contributed to McClain's death, but could not determine the cause of his death. He added that it could have been either an accidental death caused by a reaction to the ketamine, a natural death, or a death linked to the carotid control hold used by officers.
McClain was a 23-year-old massage therapist who liked to play the violin for shelter animals. He weighed just 140 pounds.
A moment ago, I showed you this ketamine continuum. Elijah McClain weighed about 143 pounds, and he reportedly received 500 milligrams of ketamine. He had already passed out from a chokehold before he had been given the ketamine. There were no drugs in his system besides marijuana, so no stimulant medications, nothing that would give him superhuman strength. And this is where his dosage range should have been. If ketamine was indicated, remember we said 2 to 4 milligrams per kilogram intramuscular. But how much was Elijah McClain given? At 143 pounds, he was given to what amounted to 7.7, almost 8 milligrams per kilogram. Enough for someone more than twice his size. And you see where he is in that continuum. And you remember what I said about this side of the continuum. When you get up here, you're getting into the range of general anesthesia. And Elijah McClain died a few days later. At the same time, practically, that this situation was unfolding, there was another Elijah about 10 miles away who had this particular horror story to tell.
How much you had to drink?
I'm good.
Elijah McKnight says what happened to him during this 2019 arrest outside Aurora, Colorado should never happen to anyone again.
I was out cold for 3 days on life support, pretty much.
McKnight admits he was drunk on the sidewalk when police arrived to check on him. He tells police there are warrants out for his arrest. All is calm until an officer attempts to cuff him. He resists and is cuffed and tased.
Oh!
But he says what happened when paramedics showed up nearly killed him.
They were acting like I was just the Incredible Hulk and that I was tossing them around.
You're a little too hyped up right now. You gotta relax, you guys. A little bit more.
I am being quiet.
You are. I appreciate it, man.
Paramedics initially determined he doesn't need to be hospitalized.
He doesn't need to go to hospital.
Let me know.
Up to you guys.
But then a police officer asks this.
You guys can't give him anything, can you? Unless he goes.
We can give him ketamine and he'll be sleeping like a baby, but we'll have to take him to hospital.
Don't inject anything in the mother end. Oh, yeah.
Just gonna be a fight the whole way.
No, I was still.
We're going to the hospital. He's fucking the three of us. Just give it to him.
CNN reports that they first gave him a 500 milligram shot, then a second 250 milligram shot, which is definitely over the recommended dosage by the manufacturer and just by doctors.
This is the first of 2 ketamine injections paramedics administered to a very drunk Elijah McKnight last August. Later, he ended up here, intubated in the intensive care unit for several days.
How you feeling now, Elijah?
Ketamine is a drug Colorado paramedics can only administer under a state waiver. And according to state guidelines, it should only be used on patients who are so combative someone's safety is at risk, or to calm extremely agitated patients who experience a condition called excited delirium.
Rescue's here to talk to you. Are you going to cooperate with them?
Paramedics reported McKnight was uncontrollably combative and appeared to be in excited delirium when they arrived. That's a different condition than just being drunk.
Excited delirium is a medical condition that's life-threatening, and basically the patient is hyper-aggressive, markedly agitated, combative, can be delusional. So these are patients that you cannot, reason with or talk down. These are patients that are totally out of control.
My name's Steven. I'm with the fire department.
Please help me.
What's your name?
Our Fox 31 Problem Solvers investigation found McKnight wasn't delusional.
Who's the president of the United States?
He answered several questions coherently over a period of several minutes after he had been tased and handcuffed.
How many quarters are in a dollar? Good.
And they shouldn't have injected me with ketamine. That definitely shouldn't have happened.
I feel comfortable the crew did the right thing.
We talked to Dr. John Riccio in the fall. He's the medical director who reviews the situation every time South Metro Fire paramedics administer ketamine. And we've since learned he never watched this body camera video before talking to us and before doing his official review.
I think the protocol was followed. The patient had a life-threatening condition.
Every time we use it, it gets scrutinized.
This is Michael Porter, the chief officer involved with medical care at the South Metro Fire Department, who also spoke to us in the fall without seeing the body camera footage.
Our paramedics have about 1 minute to 2 minutes to decide whether or not this is going to be a drug of choice in this particular case.
But the Fox 31 Problem Solvers found paramedics had more than 1 minute to observe McKnight's behavior. For at least 9 full minutes, they talked with him.
I know it's uncomfortable right now, but you're a little too hyped up right now. You gotta relax, you guys. A little bit more.
I am being quiet.
You are. I appreciate it, man.
And they listened to his shouts, including at least 27 screams about his legs being in pain.
Get off my leg! Get off my leg! Don't break my leg!
The paramedics eventually referred to Elijah as alert.
Okay, if you guys... He doesn't need to go to the hospital.
Come down, man! Let me know!
It's up to you guys.
And initially, no paramedic suggested treating him with ketamine.
How much do police have an influence on what a medical person would decide?
None. I can say that unequivocally. They don't influence our decisions at all.
But listen to what this sheriff's deputy asks South Metro Fire Rescue.
You guys can't give him anything, can you? Unless he goes.
We can give him ketamine and he'll be sleeping like a baby, but we'll have to take him out.
Don't give me, don't inject anything in my veins. No, I was still.
We're going to I mean, he's fucking the three of us. Just give it to him.
I was being loud and all that. I wasn't physically doing anything though. I was really trying to breathe. I could tell.
Paramedics described McKnight as wildly combative after the first dose.
Put a shot into my leg.
Give him up. Optical.
This top. Bro, I got my face some dirt. I just want water, bro.
I don't think I was being wildly combative. I was just yelling, answering their questions angrily.
6 minutes after the first dose, this is how McKnight looked and sounded. And almost 3 minutes after that, they give him a second dose for a 2-dose total of 750 milligrams. Protocol suggests that's enough for a 330-pound man. McKnight weighed about 219.
I think the indications, again, for the use of ketamine in someone who's showing signs of excited delirium was correct.
They try to make it seem like I was the Incredible Hulk, but I feel like that's just an excuse. That's just an excuse because they thought they almost killed me.
In Colorado, just 10 miles apart, according to the CNN article, another guy named Elijah also had this horrific experience. I was out cold for 3 days on life support, he said. My family didn't know where I was. When McKnight finally woke up in an Aurora hospital, he couldn't believe what he was seeing on the news. His eyes widened when he saw a story about another young black man named Elijah. Elijah McClain was in a coma and near death after a police encounter that also involved a ketamine injection, the same drug McKnight had been given before everything went dark. The two incidents happened just 10 miles apart and within days of each other, but involved different law enforcement and EMT agencies.
That's where the recommended dose would be. But 219-pound Elijah McKnight, again, was given about 8 milligrams per kilogram, almost double. And he was in the ICU for 3 days. There are a number of other stories that we could talk about. Minneapolis had a snowball effect take place in their area where people were highly critical of these uses of ketamine. And these are some of the phrases that were cited in some articles over that time period. People were extremely critical, and it's what I call the snowball effect. Ended up being a public relations nightmare.
We have learned Sally Yates, the former Deputy Attorney General of the United States, is being brought in to investigate. Now, major questions were raised after a draft report by the Office of Police Conduct Review suggested officers were telling EMS personnel to inject suspects, some of whom were already restrained with the powerful sedative ketamine.
This story actually involves a black man and some white police officers and paramedics and medical professionals. Some people didn't want to talk to me about this and protocol and what's going on.
And the Fox 31 problem solver is asking important questions for you about the use of ketamine by paramedics.
In the body camera footage, you hear him shouting at various times, internal affairs, don't kill me, don't break my legs, things like that.
I tell you what shouldn't have happened. They shouldn't have injected me with ketamine.
When we see things that don't add up, we're on it. We want to go ask the authorities, we want to go look at the video, we want to compare these things, we want to bring these situations to light so that change can possibly happen, or at least some sort of discussion to make things better. Our role as journalists is important to ask the questions to make sure everybody is safe.